it's been kind of a mess for people trying to sign up. And I wanted to bring something that the Secretary of Health and Human Services, Kathleen Sebelius, said when asked about should she resign.
The majority of people calling for me to resign, I would say, are people who I don't work for and who do not want this program to work in the first place.
So, Congressman, I know you have called for her resignation. You have been equally critical of how this launch has gone. Do you think that it's time for someone else to be in charge, that someone really should be fired over this mess?
Well, that's not my choice. That's the president's choice. What I do think is that we should focus on getting the website right, and I think the president has taken the first right move of appointing Jeff Zients as a CEO-like figure to get it moving. He's got a lot of managerial experience. He's been a consultant to the healthcare industry. I think he's got the right qualifications. I would also like to see the president appoint someone permanently, because Jeff Zients has a job coming up as director of the National Economic Council, and we need someone who is going to see this website over the next 2 years and make sure that it is constantly revised and constantly upgraded, and that, I think, is appropriate.
Do you think, Congressman, that certainly the Secretary has a case that many of her critics, and there are some Democratic ones, but they're a lot quieter, have never wanted Obamacare to take effect anyway, and it sort of discounts your criticism, or one's criticism of this Republican Party, because, you know, how seriously do you take that kind of criticism? We know you don't want it to go into effect.
Candy, Americans, both Democrat and Republican, demand accountability. And Secretary Sebelius is obviously not taking accountability for this. She says the people who want her to resign, she doesn't work for. I hate to tell you, but I'm a taxpayer. She works for me. She's a public servant. I'm a public servant, and I work for the American people.
But are you a damaged messenger, do you think, that the Republicans have tried so hard to derail the President's Affordable Care Act, that now anything you do is seen as, yeah, well, it's
no, not at all, because what we've done, Candy, is try to protect the American people from the damaging effects. And now, after 3 weeks, we're beginning to see those damaging effects. We never had input to this law to begin with. We tried to tell her all along. She was the biggest cheerleader for this. Please, let it work with us. Let's work together in cooperation. And instead, she said, no, we don't want to hear from Republicans on this.
Can I set the record straight? When we were trying to pass this law in 2009, when I was working on this law, we had a number of hearings in both houses of Congress. Senator Baucus worked with Republicans for 9 months, from January all the way through the end of August, trying to get a bipartisan bill. Absolutely refused. Let me say a second thing. During that time, we tried to have find out the Republican plan that would increase access to all Americans, hold down health care costs, and improve the quality of the system to a uniform standard. There was never a Republican plan. The idea that they wanted to work with us is just false.
Okay, I don't want to get sort of bogged down in, you know.
Well, he claimed they wanted to work with us.
But I have to say, remember, the president said, I'll go line by line with any member of Congress. We wrote him letters a number of times. He shut the door in our face.
Okay, let me move this along, because I want to take advantage of both of your experiences as a physician.
Yes.
I have talked to a number of primary care physicians over the past couple of weeks, every one of whom, Democrat or Republican, has said, I think this is the end of a guy hanging out his shingle.
Absolutely.
And being done, the family physician, that there is no room in here, that Medicare is not enough to keep them alive. I've heard all those kinds of fears. So he says yes, you say no. Go.
No. So here's how the system's going to improve. First of all, if you look at Massachusetts, when they enhanced their system under Governor Romney and had 600,000 more people move in, the Massachusetts Medical Society did assessments on the waiting times. No change for primary care, no change for specialists. So this idea that we're going to have a shortage is not right. Secondly,
well, it isn't so much a shortage as, is it profitable to be, I mean, they have to make some money. They've got huge bills, as you know, coming out of medical school. Both of you know that. So the question is it going to be profitable to be a primary care physician?
Well, as someone who is a primary care physician and who actually has to pay those bills even today, I can tell you, first of all, the Massachusetts system, the waiting list gets longer and longer.
That's
the waiting time.
Factually incorrect.
Half of the primary care doctors are not accepting new patients. But to your point, Candy, Medicare reimbursements keep going down. workload in terms of paperwork and all that keeps going up. We have an unprecedented number of primary care doctors who are opting out of Medicare. And so, look, you're going to walk into the doctor's office one day with a card that says, I'm entitled to health care, and the doctor's not going to be able to accept it.
I don't think that there's any evidence to that effect. In fact, Scott Gottlieb, who's from the American Enterprise Institute, a conservative who worked under President Bush, just the other day on CNBC said no doctor shortage and no increased lines, and there's no evidence to that effect. Let me also say a word about quality. Let me say a word about quality. The bill contains a number of things that are going to dramatically improve the quality of the system and already have. For example, the number of hospital-acquired infections, because hospitals have to improve and focus on them, otherwise they get their payment decreased, has already shown dramatic improvements. Similarly, readmission rates. Before the bill, 20%. We've already seen them come down to 17.5%. All of those things are positives on the bill.
Being defensive here about this.
I'm just giving you the facts.
These are just not factually true at all. You hit it on the head. You're right.
All of those
no
are
one
data.
The primary care doctors are more dispirited today than I've ever seen them in history. It's really terrible what's going on out there.
And there is some fear, not just among doctors,
yes.
You know, and I have heard the same kind of thing, and surely you have, and perhaps you've explained it to them in a different way, but them saying, I can't take any more Medicare patients. Because it's, you know, like I've had doctors say, I will keep my guys. My guys I have now, but I'm not taking any more Medicare patients. Then what?
No, look, that issue of how the physician-patient relationship is going to change, there's no doubt it's going to change. And
in what way?
Oh, I think actually much for the better. You're going to have more of a team. You're going to have nurse practitioners. You're going to have physicians. You're going to have pharmacists. You're going to have nutritionists advising patients. The second thing is a lot more care is going to be moved into the home, out of the hospital, which is very appropriate because we're going to have a lot more ability to monitor people in the home, fewer infections, fewer falls, and a big cost savings.
This is coming from a doctor who doesn't see patients. Talk to me. I can tell you.
I'm an oncologist. I treat cancer patients.
I have a practice today that still operates. We have 3 nurse practitioners. I'm telling you that every year that goes by, we have to analyze what our payer mix is. Can we take Medicaid? Can we take Medicare? This is happening all across the country, not in Eiffel Towers.
We have a health care system that is $2.8 trillion. Okay, it's got more than enough money. The issue isn't money here. The issue is delivering efficient care and making sure that we have the right care at the right place.
I will say that some of the
control does not create efficient care.
One of the things that I also hear, and this mostly from on the patient side, is that when the president said over and over and over again, if you like your health care, you can keep it. And yet now, of course, we're hearing lots of insurance companies are dropping patients who have health care plans that don't meet the standards of Obamacare. So they are going to change doctors,
almost
are they not?
1 million Americans have lost their, have had their insurance canceled just in the last month.
Those insurance plans are not worth the paper they're written on. Many of them exclude. Many of them exclude key things that we would have.
That is totally false.
We would not allow.
These are good plans that people are being kicked off.
Are you going to allow me to finish?
But you're doing all the talking. Filibustering is not going to win your argument here, sir.
We would not allow unsafe cars without seat belts, without airbags on the roads. Similarly, we should not allow health plans out there that are really not health plans. McDonald's had offered a plan. It sold to its people for $50 that entitled them to $2,000 of coverage. That is not a health plan. A health plan that excludes certain kinds of care, like maternity care, is not a health plan. We have to have a minimum standard. If you don't have a minimum standard, you cannot have no pre-existing conditions and guaranteed issue, which is what we want.
I'm going to give you the last word here.
Well, I would say again, Dr. Emanuel, he's not a physician in the classic sense in terms of actually seeing patients. He doesn't know what's happening in the healthcare economy. He sits behind a desk reading all of these studies, and he's dreaming. He was the architect for this law.
Medical school.
Again, please don't interrupt me. He was an architect for this law. I don't blame him for being defensive. But the people are now experiencing all the damage and the hurt that's coming from this law.
They are, but you would concede, would you not, that people who do not have health care, 30 million, 40 million, whatever we currently is, 50 million, will be helped by this, and that's not a bad thing.
The CBO says that that number will never go below 30 million Americans.
The fact of the matter, all of us are
Not
also.
Dr. Zeke, the CBO says
All
that.
of us are hurting all of us are hurting from high health care costs and uneven quality. And the bill's going to repair those things. And the Republicans never had a proposal to address high health care costs or uneven quality.
We have many
I'll have
proposals.
you back, I promise, Dr. Emanuel. Doctor and Congressman, thank you so much for being here. We appreciate both of you.